Hello and welcome to NewsHour from the BBC World Service. We're coming to you live from London. My name's Paul Henley. First today, there is growing evidence that India has been dramatically underreporting the number of deaths from COVID-19 there, as the country grapples with a second wave of the virus already well documented. One report from Delhi suggests figures from crematoria could be double the official government statistics, only fatalities registered by hospitals. So what do the doctors in Kolkata have to say? Kunal Sarkar is Senior Vice Chairman at a big hospital in the city, currently treating many COVID patients. It's called the Medica. I asked him about that figure of over 50% of people testing positive at the weekend. Could that be true?
Honestly, the onslaught is so bad that they're not really even getting bothered to get tested. So the people who come up and get an RT-PCR test are people who really got at least moderate symptoms. So in that category, it's not surprising at all that we end up with this kind of, 1 in 2 or 1 in 3 test positivity rates. It's sad, it's true.
It means wandering the streets there could be dangerous.
I think the short answer is yes, it could be. The blame lies in our quarters that we allowed the problem to get out of hand to this extent. And that is that is exactly how with our population, not just the population, I think what's more important is our population density. And as you and I talk about Kolkata, you must be sort of aware of the fact that we really stirred the problem for ourselves because we had the monstrosity of a 45-day fetch of an election with all kind of pandemonium and mayhem all around, rallies and people in thousands, hundreds of thousands gathering. So this is exactly the kind of things that makes the pandemic worse. And, we are really suffering for that.
So you blame the government and its election planning more than you blame the high transmissibility of the mutant virus that's there?
Oh, I think, anything will transmit itself if you allow this kind of mayhem to happen. But can you imagine that in the densest populated state in India, we were being stupid like this for a period of 45 days. Huge entourages of politicians, their followers, crisscrossing the state from north to south. We've allowed this to happen right in front of our eyes.
Now, we take all these observations on board, but you're a doctor. What can be done medically to help things now?
When people feel unsafe and insecure, they end up stacking up oxygen cylinders in their home. And this leads to, because India's oxygen crisis is not a crisis of capacity, it's simply a capacity of distribution. We don't even use half the oxygen that is manufactured in the country, but we are allowing the oxygen cylinders and stuff to be stacked up in people's homes. You can't even imagine this. This is a ridiculous situation.
And how will foreign supplies help this? Some of those aren't cylinders, they are oxygen converters, as they're called.
But honestly, much of this would be a public relations exercise because some of this liquid oxygen and cryogenic oxygen, etc., would come in a central depot. And then again, from the central depot, you would require this stuff to be transported to all the outlying places. If you allow people to be keeping 4, 5, 6 cylinders in their homes, there are that many of us that we can eat up to the cylinder numbers in any time. But this should not be happening in the first place.
What do you make of a statement by one spokesman for the World Health Organization in India that part of the problem is that too many people are taking themselves to hospitals when they would be better treated at home?
That's absolutely wrong. That shows, how distanced the World Health Organization is from reality. Currently, you look at all the epicenters we've had, you look at Mumbai, Delhi, the states, Maharashtra, the Union Territory of Delhi, currently Bengal, Uttar Pradesh, less than 15% of the affected people get to a hospital in India. A vast majority, about 80-85% are being managed at home anyway.
And the number of deaths, official and non-official, is tragic. Of course it is. It's overwhelming. Is there a pattern in these deaths that is different from in other places in the world? Are younger people dying?
So essentially, we are seeing a lot of people in the age group of 30 to 45 who are coming into hospital desperately sick. And the point, which is very scary, is doctors were used to the pattern in the first installment that what used to happen is that you got the blast of the disease from about the second week. But this time it's coming very early. It's coming very early. By day 3 or day 4, there are youngsters who are coming with their systems completely knackered. The clinical pattern has changed between the first and the second wave.
That was Kunal Sarkar, Senior Vice Chairman of the Medical